The next special test that we're going to be doing is to assess the collateral ligaments at the elbow. And this first one that we're going to be doing is going to be a valgus stress test. And for this one, we want to flex the elbow to 25 degrees of flexion. So here is 0 degrees, and right there is about 25 degrees of elbow flexion. In this position, we're going to be doing a valgus stress test. So we're going to be holding the distal forearm. We're going to be applying our resistance here laterally, or to the lateral side, and then our distal portion is going to come laterally. Okay, and then what we're doing is we're pushing stress, and we're checking for laxity here on the medial side. So we're assessing our medial collateral ligament, so the elbow, or our ulnar collateral ligaments. And then we are in the same position. We're going to change and again come in or up into 25 degrees. Now we're going to be pushing same hand position, but now our resistance is going to go against the medial side, and the distal forearm is going to be pulled medially. And this is assessing the collateral ligaments on the radial side or the lateral collateral ligaments. So again, you're just checking to make sure that there's an end feel, it stops. If not, if there's joint laxity, it could indicate a sprain or a tearing of those ligaments. Okay, the next special test that we're going to be doing is called a moving valgus stress test. For this one, we're going to have the patient standing, and what we're going to do first is we're going to have her flex the elbow to 90 degrees, and then we're going to have her abduct her shoulder here to 90 degrees. Then we're also going to put her into external rotation at the shoulder, and then we're also going to fully flex the elbow to this position. So we have her in shoulder abduction and shoulder external rotation, and then full elbow flexion, which should be about 150 degrees. Then we're going to apply a valgus stress test to the elbow. Maintaining that, then we're going to slowly extend the elbow. Well, again, when we have the external rotation and the valgus force, at about, pain may occur usually between 120 degrees or 70 degrees, but then you want to go all the way down to 30, again while you're applying this valgus force, and have them note where any pain or laxity is when you're applying that force. A positive indication might be for, again, laxity or pain over the medial side, indicating medial collateral ligament sprain. We're going to be performing a posterior lateral rotary instability or a pivot shift test for the elbow. And for this one, we're going to have the patient lie supine position, and with the outside elbow, we're going to go ahead and have her flex the shoulder to about 90 degrees, and then I'm going to have her flex the elbow to about 90 degrees of elbow flexion. And then again, having her relax as much as possible. Now I'm going to place one hand here at the wrist, and the other hand is going to be here on the lateral side of the elbow. The other thing is I'm also going to have the palm up. So while I'm in this position, I'm going to apply a longitudinal axial compression to the forearm. And then I'm also going to apply a valgus stress test in this position. And what I'm doing is now I'm going to slowly move her, again maintaining the compression and the valgus stress. I'm going to slowly move her down into elbow extension. Again, compressing and shifting the joint. So it may actually shift out. You may feel a shifting or pain over the medial collateral ligaments.